Does any of you watch Hollywood movies? Yeah. What's the main thing that you like about the movies? Stories, right? So whole day, if I see 3 patients a day, I listen to 3 stories, like from their childhood to their adulthood, stories of their parents and other things, and of course, you become an important part of their story as well because you help them, right? Good morning, everyone. It's still morning, and let's talk about psychiatry today. What are the things, when you have to choose a specialty, what are the things that you look for? Can anyone say like work-life balance?
Family friendly, like it's not too much.
Okay. What else?
Personal interest.
Personal interest. Okay.
Patient.
Sorry?
Patient.
Patient. Okay. Right.
Academic and clinical fulfillment.
Yeah. Money? Does anyone? So in psychiatry, you want to know about how can you get into the training as an IMG? How is the work? How's the money? What's special about the psychiatry? And how would your personal life be, right? Let's start with getting into the training. It's completely easy, only if you're interested in psychiatry. If you're not interested in any specialty, you would become a specialist, but your personal life and everything will be doomed. So if you are interested, it's completely easy. The only thing you have to do is showcase your interest. And the good news is that, as we have talked about the RLMT before, good news is that if you want to apply for psychiatry, you can apply in round 1. You don't have to worry about the visas and the other stuff. And you can get the location of your choice. If your spouse is living in one area, if your spouse is living in Scotland, you don't have to go to London. You can have a training post in that area. And second thing, if you want a good deanery of your choice, Maudsley, Oxford, Cambridge, you can get the deanery of your choice. So work. So every day you listen to the stories of people, like stories. Does any of you watch Hollywood movies? Yeah. What's the main thing that you like about the movies? Stories, right? So whole day, if I see 3 patients a day, I listen to 3 stories, like from their childhood to their adulthood, stories of their parents and other things, and of course, you become an important part of their story as well because you help them, right? That's one thing, and you come to know about the impact of the human thoughts and emotions on the human life. Everyone likes to study psychology, behaviorism, learning theories, and all the aspects of this neuroscience. It's always interesting. Even I was at home, and my 5-year-old nephew, he was watching on the YouTube the things about the brain, and he was quite interested in that. And yeah, it's always like helping people get along into their lives, making them happy. It's always a satisfying experience. About the money. So even during the code training, you get some extra bucks. I don't know how. Maybe it's because it's maybe because it's a shortage occupation job. You get some extra. It's probably £280 per month. You get extra than the other like the medical specialties or the surgical specialties. When you become a consultant, or you are at an ST level, you can work in private clinics, you can work in rehab. Even during the code training, you can go for the locums in the the de-addiction centers, and you can have a lot of per hour rate. Then when you become the registrar, or you are a consultant, you can also do these types of out-of-hour works like mental health assessment, DOLS assessment. So you are paid £180 per assessment. Suppose you are sitting, your spouse is not at home, and you are sitting idle on a Sunday, and you do 10 assessments during that day. How much would you earn? So it's 180 into 10, so it's 1800, and you can go on a pretty nice dinner with your spouse. Then a special thing about psychiatry is that you only work 4 days a week, like the clinic, when you are a specialty trainee, and you have 1 day reserved for a special interest day. You can do anything: teaching, research, improve the quality of services, leadership and management. You can go for an MBA, work with charity. You can do anything that you want. And personal life, obviously, the big thing in medical, when we choose the medical stream, we know our life is flooded with exams. But after you complete your MRC Psych exam, you don't have to appear in any exam at all. There's no exit exam for psychiatry. It's a big thing, right? And the total time of training is only 6 years. 3 years for core training, 3 years for the specialty training. You become more emotionally intelligent. You learn from people's mistakes in life and relationships, and you can apply those in your life. And your on-calls are, I've had night shifts when I was just going to the hospital and sleeping there. So sometimes it can be quite busy and quite tricky as well, especially with the suicidal patients. It's the dark side as well. But most of the time, it's like quite chilled out. When you become a specialty trainee or a consultant, you do on-calls while you're chilling with your baby or your wife, because you can just redirect what to do over the phone only. So yeah, so that's me. What happened to me over the last 1 year, I'm a CT2 in this Oxford Deanery, and my next rotation is, the first one is the Oxford University Hospital NHS Foundation Trust and the very famous Broadmoor Hospital. I recently passed, like 4 days ago, I think. I recently passed my MRC Psych A paper as well as my ARCPs. I'm a neuroscience champion for the Royal College. I got the chance to be a trainee representative for the trust, local trainee rep for School of Psychiatry. I recently presented 2 posters at the international conference and attended numerous courses, conferences, workshops. So basically you have got lots of time to do whatever you want during over the last 1 year. If you come to my deanery, Oxford, you'll have access to the Oxford University library. You'll be taught by the professors over there, and it's a nice place to live. Yeah. So are you guys interested in developing now the interest in psychiatry? Yeah. So if you have recently graduated from the university, obviously you need to do FY1 and FY2. After that, you can directly get into CT1, and you have 3 years of core training, and then you have an interview, and you have to get into the specialty training. 3 years of specialty training, you're a consultant, problem solved. Okay, so core psychiatry training, you don't need a prior experience in psychiatry. You don't need to clear any part of the MRC Psych before applying for the psychiatry training. There's one more thing, exciting thing that we have started is the CAMS training. It's a run-through post. You just appear at the CT1 level and you exit at the CT6 level, ST6 level. So you don't have to appear in the interview again. So it's a child and adolescent. Obviously, if you are interested in that. Then, what do you do during the core training? You rotate between the different subspecialties of psychiatry. You're the first person on call. Obviously, you have to be at the hospital. You can't stay outside. You have to be at the hospital because you respond to the various psychiatric emergencies usually. We send the patient when you have to look at if there is any medical issues as well, and then you can direct the patients to the A&E and stuff. Core psychiatry training, if you want to apply for Northern Ireland, they have a separate program for it. For the Scotland, Wales and England, there is this National Recruitment Office, it's in Manchester. And yeah, as we talked about it, it's a shortage occupation list, core psychiatry training, and you can apply in round 1 and get selected in it. You're finished with the core training in psychiatry, you get into the specialty training. You have this thing called protected time, 1 day per week. You can do anything, not like literally anything. You have to be in the hospital, but you can do these things. Like you can even go for the academic psychiatry, addictions, eating disorders, all that list. And You can choose these specialties. If you how many people here like kids? Yeah, you can go for the child and adolescent psychiatry. Like everyone likes adults, so you can go for some people like old age, old people as well. They can go for the old age psychiatry. Then there is learning disability, medical psychotherapy, and the forensic. So there's a lot of money in forensic psychiatry, trust me. All right, thanks a lot.
So you get like one location, or you have to rotate between hospitals for the 6 years? If you could just give us an idea.
So you will get a deanery.
All right.
Yeah, so a deanery, the second reason I chose Oxford was it's a small deanery. So if you live in one place,
and you can easily
it's very easy to, If you choose a big deanery, I don't know, I think probably in the north, the north deaneries in the north, they are quite big. So you will have to rotate a lot.
So it's easy to choose a small deanery and get it?
Choose a small and a good deanery. I would recommend Oxford, very nice deanery, and the traveling time is not that big.
Thank you.
I'm sorry, what about the portfolio? Does each of the segments have a weight burden that they'll be weighted, like teaching is this percent or publication?
Unfortunately, for psychiatry, they have kept it a secret. I don't know why. So psychiatrists are weird, I know. They have kept it secret, but for the other like the surgical specialty, they have kept like this much has 4 marks, this has 5 marks.
So is it available in the website?
Yeah. Because they I think they allow the open approach. Like if the person is very good communicator in front of them, they would like try to support them higher. So probably that's why. But these are the basics, the things I showed. These are the basics. If you have one thing from all of these, you are in. If you have just